Vaccines basically work by mimicking infection, engaging the immune system without causing the full-blown disease. The active ingredient in the vaccine is called the antigen. In the simplest case, that can be a killed virus or killed bacteria, but it can also be an inactivated virus, or it can be just a piece of the virus, a protein piece that is engaging the immune system, causing antibodies to be made, and also cells called T cells that help in the fight against the disease. If you get a vaccine, you might feel a little pain at the site of the injection. All of you know this from the flu vaccine and the COVID shot. And you may even have a little fever for a day. And that shows you that the immune system has recognized the vaccine and the vaccine has taken. So that's actually a good thing. Multiple doses of most vaccines are necessary because the initial antibody response wanes over time. So you have very good level of antibody right after the vaccination, but after a few years it may go down and then you may have to get a booster. The respiratory viruses, like the flu and COVID, are specifically in need of annual boosters because the immune response goes down so fast. It doesn't last more than a few months. Also, the flu changes every year. There are strains of flu. Some strains are common, some strains of flu come only every 10 or 20 years. So the vaccine that we have is made specifically for that year. So for everybody, the CDC recommends annual flu shots and COVID shots. For people with impaired immune systems, it may be necessary to have broader protection and have additional vaccines. And that really depends, and ask your doctor about which vaccines are recommended. In older people, the CDC also recommends vaccines against certain bacterial infections. Vaccines have eradicated smallpox, and they have alleviated many diseases. Those of you my age will remember that people born in the 50s might have had polio, and some of these children ended up in the wheelchair or with paralysis for the rest of their lives. That doesn't happen anymore because of the polio vaccine. So vaccines are the most effective way in the broad population, public health, to prevent severe diseases. The effectiveness of vaccines depends on the strength of the immune response and the duration of the immune response that you elicit. Here at the Immunology Center of Georgia, we work on vaccines in the cancer arena. So cancer vaccines can boost other immunotherapies that are used for cancer. And we're also working on a new class of vaccines called tolerogenic vaccines. Tolerogenic vaccines are fairly new development, and they're a little bit the opposite of a regular vaccine. So they target autoimmune diseases. In an autoimmune disease, the immune system mistakenly attacks cells and tissues in your body. And the tolerogenic vaccine teaches the immune system to tolerate that, to not attack the self. And therefore, these tolerogenic vaccines are able to address autoimmune diseases, including cardiovascular disease.